So you know, like that feeling that you have when you have an eyelash in your eye and it's just like irritating and it's just uncomfortable, right? So imagine that times 1,000. Suck it up, Buttercup. Yeah, suck it up. Hi guys, welcome back to my channel. If you are new or this is your first time watching me, welcome. My name is Esme, Esmeralda, or Esme the Great. Today's video is going to be about eye surgery that I had done earlier this year. I did undergo lazy eye or strabismus muscle eye surgery. And so if you're interested in hearing the who, what, where, when, and why of my surgery earlier this year, then please keep watching. If you haven't already done so, please subscribe to my channel, turn on your notifications, that way you're notified whenever I upload a new video. And let's go ahead and get into this. So I did have eye surgery last year, and I had eye surgery to correct a lazy eye that I had. It was here to my right eye, and I had an outward drift. So this eye always was kind of out looking this way, while this one was straight. And I suffered from lazy eye pretty much my whole life. I actually was told at a young age that there was nothing that could be done to correct my lazy eye or the vision, because I also have poor vision in that eye. When I was younger, the lazy eye was somewhat noticeable, but I feel as though as I got older and as I kind of experienced some traumatic events in my life, the lazy eye just got progressively worse. And it got to a point where it was like so embarrassing. I avoided eye contact with anybody at all means possible, which kind of sucked because I work in the medical field, and so obviously you need to have eye contact with your patients, with your doctors. So it was really hard. It was really uncomfortable, and not to mention, like, the worse the eye got, the lower my self-esteem went. So I was actually having dinner with a friend one day, and she had mentioned how her son was going to undergo this surgery, but her son was 15 years old. And I was told previously when I was younger that once you were older than 5 or 6, there was nothing you can do to correct your lazy eye. So obviously I was intrigued. I was kind of taken aback, to be honest, because this went against everything that I was told or that I believed for so many years. And so she had told me, yeah, he had this surgery when he was younger, and now that he's older, he's going to have the surgery done again. So then I started doing my research to see if what I was told years and years and years ago was indeed true. Now that I was, you know, older than 5 or 6, there was nothing I can do. And to my surprise, there was surgery that I can have done. It is a surgery that is typically done in childhood. I did go to my primary doctor, who gave me a referral to an eye surgeon, and then I went to go see the eye surgeon, but the eye surgeon stated that he doesn't do those procedures, that he would need to send me to a specialist. And so he ended up sending me to a specialist, and it was actually really funny because it was a pediatric office. There were nothing but kids, because again, this is a procedure that is typically done in childhood. And so I went to go see this pediatric eye surgeon, and it was actually pretty funny because every time I would check in, they would ask me, what's the child's name? And I would say, no, I am the patient. So it isn't common that adults are in these practices as patients, but it does happen. So I went in and I had my consultation with the surgeon, and she just went over my medical history, and she kind of measured my eye, and then she said, okay, so you are a candidate for surgery. After I had my consultation with the actual surgeon, I then had a second appointment, and this was with someone who only did testing. So she took a bunch of pictures, and she did a bunch of measurements, and she did a bunch of tests. And again, this was to have a precise measurement so the doctor would know exactly how much she had to move that muscle so I can obtain alignment in both eyes. Then I had my pre-op with my surgeon, and during my pre-op we went over the procedure that was going to be done, how long the surgery was actually going to take, how long the recovery was going to be, what to expect before, during, and after, and then the do's and don'ts in preparation for the surgery. And so then comes surgery day, and I was nervous, but I was also very excited because, again, this is something that I dealt with all my life, and for so many years I believe that there was nothing I can do to correct this. Comes the day of surgery, my sister actually took me because I was going to be put under general anesthesia, and so obviously I wasn't going to be able to drive myself home. It was an outpatient procedure, meaning you go in, you have your surgery, you don't stay overnight in the hospital, you go home. And so my sister took me home, and the surgery itself was about 2 hours, and when I woke up, I'm not even gonna lie, I was in a lot of pain. And it wasn't necessarily pain, it was more like a discomfort. So you know, like that feeling that you have when you have an eyelash in your eye and it's just like irritating and it's just uncomfortable, right? So imagine that times 1,000. That is what I felt. And the reason that it felt like that was because I had stitches in my eyeball. And so every time I would move my eyes, you know, look left or look right, obviously those stitches would just irritate the crap out of my eye. And I was extremely uncomfortable. Discomfort, to be completely honest, lasted about 2 weeks until those stitches actually dissolve. Those stitches are not removable, they actually dissolve on their own over time. There was one stitch that did not dissolve, so my surgeon had to go in and actually remove it. But she did wait 2 weeks, so she wanted to wait 2 weeks to let it do its thing. And then when we realized, okay, that stitch isn't going anywhere, she did end up removing it. So it was uncomfortable. And it was painful, but not painful like an agony painful. It was just painful because it was this discomfort that I could do nothing about. And so I wasn't able to drive probably about 5 days. And even when I did drive, I was super cautious, and it was super uncomfortable because obviously when you're driving, you're looking left and you're looking right. I mean, that is if you're a good driver. You're looking left and you're looking right and you're looking over your shoulder, and it's hard. It's just hard. It's uncomfortable. So I did end up driving at 5 days post-op, but it wasn't fun. A funny story, I thought I was all that in a bag of chips, and I took 1 day off of work after my surgery. And then the following day, I was like, you know, no biggie, I'm gonna go into work, because I do mostly computer work and I have one good eye, right? So I went into work and, you know, I'm gonna do this, no biggie, I'm tough. And I went into work for about 2 hours, and then I had to walk into my manager's office and be like, look, I really have to go home. I underestimated just how much discomfort I'm gonna be in. Simply looking at the computer screen, you know, you're looking and you're moving your eyeball. So you're like in this screen and then in that screen, and then you're clicking here and you're pulling up the patient's insurance, and now you're looking here and you're verifying eligibility and entering an author. So I'm constantly moving my eyeballs, and so that was not fun. So I did end up going home, and then I took 2 additional days off. So in total, I took 3 days off of work. I did go back to my surgeon's office at the post-op, and I was like, you need to give me something. You need to give me something to numb this discomfort. Like, it's driving me insane. Like, literally all I wanted to do was like close my eyes, sit in a dark room, and not look at nothing, not focus on nothing, just because I didn't want to be moving my eyes around. And so she did put some eye drops that numbed my eye, and oh my god, it was the best feeling ever. And so I asked her, can you prescribe that for me? I want to take that home with me. But unfortunately, she said that she wasn't able to prescribe that because over time that would make my eyeball shrink. And so she wasn't going to prescribe it. So I was like, suck it up, buttercup. Yeah, suck it up. I was extremely swollen. It literally looked like I had gotten beat up. So this eye was bloodshot red. It wasn't even pink. I'll go ahead and put some pictures just so you know exactly what I'm talking about. My eye was red, not pink, red. That lasted for about a month. Obviously, as time went on, the redness got a little lighter, the swelling went down, but for about a month it was pretty bad. And then I would say it took about 3 months for everything to go back to normal, except even till this day, I do have a little bit of pink in the inside of my eye. So my actual surgery was here on the inside of my eye and then on the outside of the eye. And so when I do look, I don't know if you guys can see it, there is a little bit of pinkness that's still there, but it doesn't bother me. Honestly, in comparison to how bad my eyes were, like, I am over the moon with my results. And so yeah, it was about 3 months to go back completely to normal, for the redness to be gone, for the swelling to be gone, for the stitches to be dissolved. I did still have, and I still do have, that little bit of pink in there, but it was about, give or take, 3 months. And so a lot of people ask me, would you do it again? Knowing what you know now, would you do it again? And without a doubt, no questions asked, absolutely I would. I'd do it 1,000 times. Was it uncomfortable? Yes. Was it painful? Yes. Was it just agonizing throughout the recovery? Yes. But the confidence that I have now, and just the ability to look people in the eye and not be embarrassed, like, I can't even put words to that. Like, all my life, I had been ridiculed, I had been made fun of, and when I wasn't being ridiculed or being made fun of, I was ridiculing myself. Like, I was just so insecure, so ashamed. I remember just wondering, like, why me, God? Like, why me? And here we are, fast forward, I don't have that anymore. So would I do it again? Absolutely, without a doubt. Find yourself a surgeon who is reputable, find yourself a surgeon who has good reviews, do your research, and just put it in God's hands. And I promise you, you are going to be happy. So if you are wondering, you are kind of on the fence, should I do it, should I not? I'm not gonna lie to you, it's uncomfortable, it's painful, it's kind of annoying, the whole recovery period, it's annoying. But I would do it again in a heartbeat, no questions asked. Being able to look people in the eye and not look away, or not have to tell people, like, no, I'm talking to you. You don't know how many times at work I would call patients and be like, you know, Mr. Smith? And Mr. Smith would, like, look like, are you talking to me? And it was because of my eye, and that was embarrassing. And it wasn't because they were being jerks, it was just because they weren't sure what the heck I was looking at. And I don't have that anymore. And so I would go through it 100 times if I had to obtain the results that I have now, the confidence that I have now. Just being able to look people in the eye and not be embarrassed, I wouldn't change it for the world. In case you're wondering what surgeon I went to, I actually went to a Dr. Kim. She's here in San Diego. She does work out of Children's Hospital over by Sharp Memorial Hospital, and that is on Frost Street. However, she does have privileges at Sharp Memorial Hospital, which is where I had my surgery. So if you have a child that you're wondering who's a good surgeon, I would recommend her, no questions asked. Or if you as an adult are wanting to undergo this surgery, I would recommend her. She is amazing. She has wonderful bedside manner. She is so patient. I was that difficult patient. Every time I went in to see her, I had a list of questions. Who, what, where, when, and why. And she never made me feel rushed. Her skill as a surgeon is amazing. She's patient. She's just amazing. So if you're looking for a surgeon, hopefully she accepts your insurance. If she does, I recommend her 100%. So there you have it. That is my story time on my strabismus lazy eye surgery that I did undergo as an adult. If you have any questions, comments, or concerns, or anything that you want me to elaborate on, please drop that in the comments below. If you like this video, please give it a thumbs up. If you haven't already done so, please subscribe to my channel. Turn on your notification bell, that way you are notified whenever I upload any new videos. And thank you so much for watching. We will talk soon. Toodaloo!